Welcome, Hudson Valley, to this week's edition of In Touch, the public affairs and issues program that runs across Townsquare Media, the Hudson Valley radio stations. Today's guest is Dr. Angela Glymph, CEO of Peer Health Exchange, in to talk about the latest revolutionary peer-to-peer mental health platform geared toward today's youth. We invite you to join us and listen to a previously recorded conversation between Angela and myself here on In Touch. Hello, Hudson Valley. You're listening to In Touch, Townsquare Media, the Hudson Valley's public affairs and issues program. May is Mental Health Awareness Month, and if you've been listening all month long, then you know that we've had some incredible conversations on the topic, ranging from drug abuse to disabilities and mental health illnesses, and how to seek counseling and resources for it all. So here we are wrapping up Mental Health Awareness Month. It's Memorial Day weekend. We have an excellent show for you today. One that I'm sure that will be able to help not just today's youth, but the family unit as a whole. With us today is Dr. Angela Glymph. Dr. Glymph is the CEO of Peer Health Exchange. Now, Peer Health Exchange provides young people with support, resources, education opportunities, and digital products needed to make positive health decisions. Dr. Glymph has accumulated 15 years of experience and expertise developing and managing health and educational equity programs, as well as evaluating health and educational outcomes of such programs. She's an accomplished businesswoman and a published author. Dr. Glymph has written several books on the topic of mental health and related subjects, and one thing that I'm really excited to talk about today is Selfsee. Selfsee is a peer-to-peer platform with mental health resources, support, and stories for young people from young people. But that's enough of me talking. I'm really excited to have her in today. Angela, how are you?
I'm doing well. Thank you for that amazing introduction.
Well, hey, I just take what you do. You're the one that lived all of it. So it's always great when we have somebody that's so accomplished, so well-versed in the field that they are talking about. And I'm sure that this is going to be an incredible episode for everybody listening here in the Hudson Valley. And I'm sure it's going to be very beneficial for everybody. So one of the things that I always like to start off with is just an overview, a broad, general idea of the organization or charity or whatever we're working with. So could you please start us off with giving an overview on what Peer Health Exchange is?
Yes, thank you for that. So Peer Health Exchange, we are a national nonprofit that just turned 20 years old back in March.
Congrats.
And we actually started doing our work in New York. So really excited to be sharing what we do with your audience. But yes, so we work to create healthier communities by, with, and for young people. We have two primary ways that we are reaching young people with the health support, resources, and education that they need to make healthy decisions for themselves. We do that through schools, so that has been the historic way that we've reached young people. We train college-age young people to teach health education workshops in schools across the country, focused on mental health, sexual health, and substance misuse prevention. And then the other newer pathway of reaching young people directly is through digital means, one through social media. So TikTok has been a really important platform that we have leveraged because we know that young people spend their time watching TikTok videos, and we are able to partner with young people who are content creators, and they share stories and resources around mental health and sexual health. So again, it's an entertaining, useful, and impactful way of reaching young people and connecting them to health resources. And then through our digital app, which you mentioned in your overview, Selfsee, which is an app and platform that is designed with and for young people. And again, it is another opportunity to reach young people that we're unable to do in classrooms, and connect them to the resources that they need. But also it's an opportunity for young people to find community with other young people who share similar experiences and identities, just so that they can feel they're not alone in this world that we live in, and sort of the experiences and challenges that they have to navigate right now as young people. So we're really excited. Our goal is just to be available and provide young people with what they need wherever they are, whenever they need it. And Selfsee has been a powerful, newer platform for us to be able for us to do that work. So really excited to share more about that as we dig in.
No, that's really terrific. The availability and awareness is one of the biggest things these days because it's hard to know what you don't know. So to be able to be out there is very important. And I love what you said a moment ago about like getting onto TikTok and similar apps like that for young people, because that's already where they are. And a message that, one of my favorite authors and speakers, Jay Shetty, always preaches: entertainment can also be extremely educational at the same time. And it could be so good, you may not even realize it's educational, and you're kind of synthesizing it at the same time without knowing it. And that's cool that you're really incorporating that kind of idea. And I really love that. And we'll dig into Selfsee specifically in a second. And I'm sure actually you'll probably have a lot to say with this question. The pandemic, of course. The pandemic was an unprecedented time for everybody. So I've worked as a summer camp coordinator for several years. And then when we had our first year back after the lockdown, there was a major change in the spirit of the kids and teens. It was much different. It felt like everybody was defeated, depleted, all that. It was not the same joyful energy that it once was. And then, mind you, that was 2021. 2022, things were better, but there was still a big change. Something was noticeable. And I can only imagine what that's like for schools and youth groups. So that leads me to what I really wanted to talk about next was, how has peer health exchange evolved since the pandemic to address this unprecedented culture shift?
No, that's a really great question. There are a couple of ways that we evolved. I will take us back a little bit pre-pandemic.
Yes,
so
please.
as I mentioned, historically, peer health exchange was, we had been known for doing school-based work. We were a solution to schools, and mostly schools that we work with are in underserved communities, under-resourced, and can't afford actually to provide health education, right? And we know, when funding decisions need to be made, what gets prioritized are, subjects like math and reading and science, and what often gets deprioritized are like arts and health education and sometimes physical education. So we have historically and continue to be sort of that solution to schools and districts that are challenged and living in under-resourced communities. So with that said, that has been our work, right? Primarily for 20 years. We are going to continue to do that work because unfortunately there's still a need in that sector. But we know, right? We cannot be in every school and every community in this country that needs health education. So we always knew that we were going to have to figure out that health equity solution. And so in the back of our minds before the pandemic, it was always like, okay, we gotta embrace a digital pathway. We need to figure that out because that is the only way, right, that we're going to be able to address that barrier. Then 2020 hits us in the face and really sort of supercharged our need to push forward on our digital work because guess what? Schools were closed. So that means we were out of business, basically. We could no longer do the work that we do because that involved schools. We were in classrooms. And when those doors closed, that meant we were not able to do our work. We were not able to reach young people and provide them with the health resources that they need in the most critical time where they needed, health information. And that was just unsettling to us. And so really that was sort of our pause, but also sort of that kick in the butt, if you will, that we needed to push forward on digital solutions. So immediately we knew that in order for us to be successful and have a shot at being successful and getting to the 191,000 users that are currently using Selfsee, we had to listen to young people. We needed them at the table. We not only listened to them, but we actually needed to be led by them. They really told us, like, okay, we're on social media. You need to get on social media. And more importantly, we're on TikTok. So we need to be there. And matter of fact, Peer Health Exchange will help you with content because we know how to reach our peers. We know what will grab their attention. So that was the first thing. And then with the digital app, they said, hey, we're not in schools. We don't know where to turn to. We don't know where to go for resources. We're struggling. We find a lot of social support in schools, and our social interactions have been cut off. So we need connection. This platform needs to, one, have reliable and valid information on how we get the help that we need, specifically in mental health, but also, can you connect us to our peers? And that really, sort of that insight and that direction from young people is what we took, and that got us to where we are today. So 10 million plus views of our TikTok content that is created for and by young people.
There you go.
And then 191,000 users from across the country utilizing Selfsee, and about 9,000 of those users come from New York. So we have been really pleased. It exceeded our expectations of what we're able to do. But more importantly, going back to that health equity challenge, it is really a solution that is allowing us to show up for young people with whatever they need, whenever they need it. And that's what I'm most proud of.
That's really awesome that you're able to address that and kind of be able to shift things. One of the beautiful things about the pandemic, even though it was a very dreadful time, there were a number of silver linings and a lot of shifts in the right direction and in new directions that a lot of us didn't think that we could necessarily go in, that ended up being positive in the long run. And it sounds like that you guys found a lot of really interesting initiatives. Again, you're listening to In Touch, Townsquare Media, the Hudson Valley's Public Affairs and Issues program. We are speaking with Dr. Angela Glymph with Peer Health Exchange, how Peer Health Exchange is reaching out to the youth community and listening to them, meeting them at the table. What do they need for their own mental health? And one of the things is Selfsee. Now, based off what you were saying, it sounds like Selfsee came out of the pandemic then. Was it around prior, or was it a reaction to the pandemic?
It was a thought prior to the pandemic, right? Like we sort of had this vision of like, we know we need to do something digitally to reach young people that we can't access, right? Or we need to be able to reach young people beyond school hours, right? It was an idea that had been there and thoughts and but we never really iterated the way that we needed to on the idea until the pandemic hit. So like I said, the pandemic really sort of pushed us forward or propelled us, because otherwise we weren't being able to carry out our mission with schools being closed, right? Yeah. And again, that was the most critical time in the history of our country where we needed to show up more. If any time, it was during the pandemic that we needed to show up for the young people that we reached. So it sort of propelled sort of that idea, and that we really organized ourselves to innovate, to work with young people, to be guided by young people, and to really supercharge that idea that we've had before the pandemic to make that a reality.
Yeah, it was kind of the I hate saying this, but right place, right time kind of thing. Pandemic was not the right place, right time, really, but you guys were able to come in, take advantage, and be able to help people in a time of dire need. And that's terrific. And it's still very much a need today, because the conversation on mental health is very prevalent, but at the same time, there's so much that still needs to be learned and understood. So when it comes to Selfsee, the platform, how can people access it, and what are some of the resources specifically that people can find on it?
No, that's a great question. So you can access Selfsee by going to the website Selfsea, SELFSEA, like the sea, the ocean, .org. And so when you click on the website, it's a web-based app. What they will immediately see is a connection to resources. One primary resource that we provide are these content videos that are created by young people across the country that have various identities, that are sharing their stories and their, lessons learned and resources that have been helpful in supporting different aspects of their health. And that ranges from mental health also to sexual health. And young people really gravitate to hearing from their peers, young people that have shared experiences or shared identities. That's really impactful. If we put ourselves back to adolescence, right, we didn't really want to hear from adults all the time. But it's something powerful from that sort of peer education that has been the hallmark and sort of the secret sauce of peer health exchanges success in the classroom. We were able to sort of carry that over into the digital platform. So that is one main sort of hub of resources that you can find when you click on selfsea.org. But then there's also curated professional resources in the health space that we connect young people to, right? So there's, crisis text line if, young people suspect that they're experiencing a mental health crisis, or they have people in their lives that are experiencing mental health crisis, that there's connection to resources like that for them to utilize. The Trevor Project, which has been a powerful resource for young people who identify as LGBTQ+. And so we have connection to the resources that they provide as well. And so they're actually able to get those very tangible resources to support their health as well on selfsea.org. And again, primarily in the content areas of mental health and also sexual health, which are both big topics that
Absolutely.
the young people we work with that they need. And they're also content areas that bring about some discomfort in talking about or different levels of stigma around talking about that. So that's another sort of need that Selfsee is actually able to address when it comes to youth health, is that, we are able to sort of create an environment, a digital environment that is safe for young people to share, to ask the questions in health content areas that are, somewhat challenging for them to discuss.
No, I think that's great to be able to help them find the words in order to express things. And that's one of the reasons why I love being in radio and love working with music, because I feel like music in particular is one way that people can find the words that they're looking for certain emotions. And that's great that you have a platform here with this that can help them find the words to be able to properly express themselves through a time period that they don't quite understand. And I want to pick apart something that you said that was really interesting. You said not just people going through a mental health crisis, but somebody that has a family member or friend who might be going through it, like a sibling or parent. So can we hone in on that for a second, actually, how Selfsee can be useful to somebody? They themselves may not be having the mental health crisis, quote unquote, but they know somebody that's having a hard time and they just want to really work on understanding where they are and how to help when they don't know how.
Yeah, that is a very powerful tool or gift, if you will, that Selfsee is able to provide, because what it does, it helps a young person like this. A young person may or may not be struggling, not quite sure, but also, to be that supportive person within their own networks, within their own environments, in their own communities, by one, offering information on how do you identify crisis, right? A lot of us, young people and adults even, don't really have that education of what the signs of, distress or crisis look like. So one aspect of Selfsee is really educating, right, young people on what that might look like. And then the next step of that is sort of the connection, right? The connection to support, because we make it very clear that we are not, we don't provide, psychiatric treatment. We are sort of a connector, right, to the folks who are trained professionally to provide those supports if they are needed. And so we make that very clear, that disclaimer very clear. And also, we want to make sure that young people have the tools that they need then to find that support for themselves or find that support for folks that they care about or they're worried about. And it's been really powerful. Like, we know and we have data that has shown us that young people actually do utilize those resources. You know, we have a partnership with Crisis Text Line, as I mentioned, who provide us with the data. So they tell us every month, yeah, this number of young people actually utilize our resources, and they know that they come directly from Selfsee. So to be able to see sort of that education then move to behavior and behavioral change that is supportive of, you know, mental well-being has been powerful to see.
That's really awesome.
But young people told us that it would work. So again, I'm proud that we listened to them.
Absolutely. Being able to listen to them and understand all of it. And people here on In Touch are probably getting sick of me saying this, but one thing that I like to say a lot is it's hard to grow alone. Just to be able to have that, all the different voices and get those perspectives and to be able to grow on that is so important. Again, you're listening to In Touch, Townsquare Media, the Hudson Valley's Public Affairs and Issues program. We've been speaking with Dr. Angela Glymph, talking about Selfsee and how incredible of a platform it is for those having mental health distress and those looking to help somebody that they know in their lives with mental health distress. And I love that this is a platform that is easy to, get into for anybody, and that it's working. It's making a difference. And I'm really happy to hear about this. We're getting towards the end of the episode, but I did want to bring this up quickly. As I said in your intro, you are an accomplished author, and I saw that there's a book that was just published recently that you had a hand in writing. And if I have this correctly, the Handbook of School Mental Health Issues in Clinical Child Psychology. Did I get that right?
You got it right.
Fantastic. Could you tell us a little bit in the part that you played in this book?
Yes, I would love to. So I will first start off by sharing the Handbook of School Mental Health is really the target audience is folks that do school-based mental health work. So whether that be providers, mental health counselors, academicians who are training folks to go into school-based climates and provide mental health education, as well as researchers and professors. So that is typically the audience that this handbook is written for, and certainly also represents contributors like myself to the space. I was invited actually by my co-author, Dr. Christina Page, who works at WestEd, a research organization, to actually contribute to this chapter that really is about how to support the success of young people by finding opportunities for adults and young people to collaborate and create really healthy educational environments that support such collaboration. And there's a lot of research that we touch upon in terms of really drawing from positive youth development, really centering young people's assets. A lot of focus, especially around adolescence, is around deficits, what young people can't do, or challenges of that stage. But this framing is really about young people have assets, and so when you capitalize on their assets and when you actually celebrate and acknowledge them, that actually is supportive of young people's growth and development, but also it is a powerful way to reduce some of those risky behaviors that, our work at Peer Health Exchange and so many others are trying to combat. And it's supportive of academic achievement. Those are the kinds of outcomes that, folks in education care about. So really, I got invited to collaborate, and she said, I heard about the great work that you have done at Peer Health Exchange over time, but specifically with co-developing Selfsee, that you co-develop this with young people and work with young people. Can you lend your expertise and experience to this chapter? And I said, I certainly will, but I cannot do that unless the other experts, who are the young people, are at the table, because they have a unique perspective that I don't think the field actually gets to hear directly, and certainly I don't possess. I'm not a young person anymore, so I can't share what it's like, or what are some of the critical success factors from their point of view of making this a very impactful experience. So she said, absolutely. And we go to the editors and we was like, we want to co-author with high school students who have collaborated with us. And they were like, oh, we've never done this before. We got to figure out if we can do this. And I was like, okay. figure it out. But if you don't figure it out, I'm not going to contribute because I have one half of the equation. Long story short, they figured it out. We produced this chapter. We're so happy. The other two co-authors were high school students at the time who, again, helped us co-create and build Selfsee. So they were able to write about their experience doing that with adults like myself and my colleagues at Pure Health Exchange as a case study. And they really shared like what was impactful, what built trust, what made them feel valuable in the space, and how that interaction was supportive of their mental health and their mental well-being, and then also subsequently their academic success. Those two young people are now, Treasure Joyner is one of them, who is a college student at Tulane University. And because of that experience, is pursuing a career in public health. Wow. Right? So even just working with young people, sometimes you are actually supporting their career goals in a way that you might not intend. Yeah. And the other is Rihanna Baghdadin, who is also a second-year college student, and again has, often stayed in touch with me and shared how valuable the experience was for her. So this is unprecedented. You never really see like high school students contributing in such a highly regarded, publication like this. So we made history doing that, but also, again, being able to contribute to the field on how we sort of bring young people into the space and value their assets, which has a lot of positive effects as we go in the book chapter. So check it out.
Angela, that's fantastic. I love the way that you are paving this road for young people to have a very powerful voice for themselves and to be able to put this all together. I'm excited. I definitely want to check this out. So that really leads to, as we wrap this up right now, what is the best way for people to find information on Pure Health Exchange, Selfsee, and yourself? Where should people go to check out more information?
Yes. So I would say the first step of learning more about Pure Health Exchange as an organization, about me, and about all the wonderful work that we're doing and resources that we provide, you can go to our website. It is www.purehealthexchange.org. You can also connect to Selfsee through our website, or you can go directly to Selfsee at Selfsea, SELFSEA.org. And I invite parents who are listening to also check it out, because what it does for parents, although it is a tool that is designed for and with young people in mind, I think it's also a valuable sort of awakening for parents to see what is top of mind when we talk about mental health and sexual health for young people. And so I would invite parents to, one, share it with the young people in your lives, but also for you to sort of get a sense of what young people are confronted with and what they're thinking about as it pertains to their health. And then again, you can learn about me through Pure Health Exchange's website, and then I'm connected on LinkedIn, Angela Glymph. You can find me there. Social media, my handle is Angela Glymph, so you can find me there as well.
Terrific. Angela, this has been a wonderful episode. Such a great way to wrap up Mental Health Awareness Month. So again, Angela, thank you so much for being able to speak to us about all of this today. We really appreciate it.
Conor, it was a pleasure. Thank you for having me, and thank you for bringing awareness around mental health. It is so critically important. So I thank you and appreciate you for doing that.
Absolutely. And hey, I hope you enjoy your Memorial Day weekend.
You do the same. Thank you.
This has been this week's edition of In Touch, the public affairs and issues program that runs across Townsquare Media, the Hudson Valley radio stations. We want to give a big thank you to Dr. Angela Glymph. For more info on Pure Health Exchange, visit purehealthexchange.org. As for Selfsee, visit selfsea.org. Again, that's spelt SELFSEA. Of course, all links and information can be found in the description of this episode. You can find In Touch episodes new and old on your favorite streaming services like Spotify, Apple Podcasts, Google Podcasts, Stitcher, and more. That and listen on demand with your Townsquare radio station mobile app. Of course, you can still find all articles and audio under the In Touch tab on this radio station's app and website. And don't forget, we're also on YouTube, Facebook, and Instagram at InTouch_HV. Whether you have a topic you want discussed or want to be a guest on the show, the best way to contact us is through our office number, 845-471-1500, or email direct to conor.walsh@townsquaremedia.com. I've been your host, Conor Walsh. Until next time, stay curious, keep an open mind, and as always, I'm glad we can spend some time. Happy Memorial Day weekend.